Where's this? 160 Woodford.
What's our pac-tv guys?
New guy.
What's
Isn't it?
yeah, no.
What's your name? Zach. Thanks for being here. When are we going to be on the audio on
Yeah,
that?
Dave.
You can thank.
I just want to know when the mics are hot.
Thanks for the candy. I have been so good, and I'm so, I have I'll start with the preamble. Pursuant to Chapter 2 of the Acts of 2023 and as amended as of March 28, 2025, this meeting will be conducted in person and as a courtesy via remote means in accordance with applicable law. Please note that while an option for remote attendance and/or participation is being provided as a courtesy to the public and board members, the meeting/hearing will not be suspended or terminated if technological problems interrupt the virtual broadcast, unless required by law. This meeting will be recorded by the local scene, formerly known as pac-tv. Members of the public who wish to watch the meeting may do so by viewing the Duxbury Government Access channels, Verizon 39 or Comcast 9. Viewers can visit https all the things, thelocalscene.media/Duxbury for information about Duxbury programming, including streaming and watching replays on Duxbury YouTube. I'm going to call the meeting to order. The first, so this is the Monday, April 13th, 2026 meeting of the Select Board, and this evening we are going into executive session. We have an executive session pursuant to General Law, Chapter 30A, Section 21A2, to conduct strategy sessions in preparation for negotiations with non-union personnel, the town manager, and/or to conduct collective bargaining sessions or contract negotiations with non-union personnel, town manager. And then the second one will be, I can do this at the same time, I'm assuming. The executive session pursuant to General Law, Chapter 38, Section 21A3, for the purpose of discussing strategy with respect to collective bargaining, since an open meeting may have a detrimental effect on the litigating and bargaining position of the town. Duxbury Police Commanders Association, Mass. COP Local 376. May I have a motion?
Well, you just read them, so moved, I think.
No, you have to move
I
that we
I
go
move
into.
that we enter the executive session pursuant to GL, General Laws, Chapter 30A, Section 21A2, to conduct strategy sessions in preparation for negotiations with non-union personnel, town manager, and/or to conduct collective bargaining sessions or contract negotiations with non-union personnel, town manager, and to enter into executive session pursuant to General Laws, Chapter 38, Section 21A3, for the purpose of discussing strategy with respect to collective bargaining, since an open meeting may have a detrimental effect on the litigating and bargaining position of the town. Duxbury Police Commanders Association, Mass. COP Local 376, and that the board reconvene in open session on or about 7 p.m.
Second.
So the motion is to enter into executive session. So if you could read the next paragraph.
To enter into executive session pursuant to General Laws 30A, Section 21A3, for the purpose of discussing strategy with respect to collective bargaining, the chair must also declare the need for executive session for that purpose.
As chair, I declare that the necessity for an executive session pursuant to General Law, Chapter 38, Section 21A3, to discuss strategy with respect to collective bargaining, as to do so in an open session may have a detrimental effect on the town's bargaining and negotiating position.
Second.
I'll take a roll call vote.
Michael, aye.
Amy, aye.
Cindy, aye.
Fernando, aye.
Brian, aye.
So we will be back around 6:30 is what we're thinking, or
7 o'clock.
7 o'clock, okay. I think we'll need every minute of that. So we'll be back at 7. Thank you.
something earlier, just
No, but I mean, you're out
text
of
me,
country from the 27th.
and I will make
No,
arrangements
20th to the
from
27th.
Aruba. It's doable,
Just move them, different footprints.
you know, I
Technically in
mean,
the country, but on an hour.
Rainey, I'm away from the
Yeah, no, that's that one. That one.
29th through the 9th.
Yeah. It's amazing that we can't get rid of it. I don't know why. It's not in the budget. Thank you, Russ. Hey, Russ.
baby.
Hey, this is fun, Russ.
Always is.
Always is.
Thank you, Russ.
Ay, ay, ay.
Thank you, folks, and I apologize for the delay. We are back in session. First item on the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. What item is open forum? Anything tonight under open forum, Mike?
No,
No.
thank you.
Fernando?
Nothing in open forum.
Brian?
Just a few things. First, before I get into one of them, Rainey, are you going to talk about East Street overpass or no? Because I'll bring it up now. Okay. All right, so I have a few things. Since our last meeting on March 30th, or our last meeting in here on March 30th, a few things to share. One is we had Nancy O'Connor's retirement reception on the 31st. That was very well attended. We miss her already. Thank you again to everyone who participated and wished Nancy a send-off from Duxbury. Second is the East Street overpass, as advertised from our last meeting. Amy, Rainey, Sheila, and I attended an on-site with representatives of Mass DOT, the contractor, which is Skanska, and Eversource to discuss the delays, the many delays on the road reopening. And Amy, correct me if any of this is at variance with your memory, but we expect the road to open by June 1st. The issue was the installation of some electric conduit that is supposed to now be done by April 24th, and then Skanska needs approximately a month or maybe 5 weeks to finish the project, and that puts us at June 1st. So the last issue was the installation of some conduit, and the information we got is the reason they couldn't put the conduit is because they needed 570 feet, and they only had 500 feet on the roll. Relatedly,
True.
the Route 3 Bridge Replacement Project, which is a separate project, is scheduled for public comment this Wednesday, the 15th. This had previously been scheduled for 2 weeks ago.
I'm sorry,
This is for the Route 3 Bridge Replacement Project. This is the actual,
Yes.
it's over by,
Island Creek.
no, Temple, yes, thank you.
Okay.
So this is going to be a public meeting, but it's going to be remote, kind of like the Route 53 improvement was. If you Google Route 3 Bridge Replacement Meeting, you can sign up on the Mass DOT link provided, if you haven't done so already. And then finally, at our last meeting, I had mentioned a number of tax relief opportunities available to residents, and one of these is called the Mass State Circuit Breaker Program for seniors. And I bring this up because there was a presentation about this at the Senior Center on April 7th, but unfortunately it wasn't recorded. With that said, however, the presenter, Brian Lynch of Mass DOR, made a similar presentation in Quincy back in March. And you can get that and watch it by going to YouTube and searching for Senior Circuit Breaker Tax Credit Quincy. And it pops up, and moderating it is Speaker of the House, Ron Mariano. And it runs about an hour or so, where Mr. Lynch talks about how you qualify and apply for that state program. So I wanted to pass that along for those who missed the live program on April 7th. That's all I got. Thank you.
Thank you. Anyone from the public under open forum? Hearing nothing, our first item on the agenda is the discussion and vote on health, dental, and life insurance. I'm not sure about the recusal. I would think for the informational part of this, that the board could stay. Randy, I'm kind of looking to you.
Shouldn't be a
But
problem, because you're not rendering a decision. Anybody taking the insurance is going to withdraw.
right, from the actual vote, right? Okay, great. And this is going to be presented by Jeannie Horn, who is our Human Resource Director.
Danielle.
Danielle Chaplick, Public Sector Practice Leader from Hilb Group.
Good evening, everyone. Jeannie, do you know if the slide deck is going to be shown?
I can email it to you.
They do have the information in their packets.
Okay, shall I just start until
I
the
would-
slide comes
yeah,
up?
I wouldn't plan on seeing it on the screen.
Okay. Well, good evening, everybody. My name is Danielle Chaplick. I remember most, or if not all of you, from last year. I am a public practice sector leader for Hilb Group in New England. I work alongside Sue Shalou, who has been working with the town for many years as one of its consultants. And then I'd also like to introduce you to my colleague, Mariana Gill, who is newer to our team and is also supporting the town of Duxbury as well. So as you suggested, you received a report from Hilb titled FY27 Health Insurance Outlook, along with a presentation for today, which provides an overview of market trends, funding options, and a snapshot of Duxbury's successes and challenges in managing health insurance over the past 5 years. It goes without saying that the ongoing healthcare crisis affects nearly all employers, insurers, and members across the Commonwealth. Health insurance remains extremely complex and continues to rise in cost, with unfortunately no clear resolution ahead. Therefore, it is crucial for the town, its members, and its fiduciaries to stay informed and collaborate in mitigating against these expenses. And that's partly why we are here today, to provide education around what's going on in the marketplace. I'd like to start with what's happening in Massachusetts. One of the first slides in the deck that you received outlines the market dynamics influencing affordability, spending, and access in the Massachusetts healthcare system. There are several dynamics at play driving up costs, including but not limited to insurer consolidations as a major factor. The merging of insurance companies reduces competitiveness in the market. We've seen this over the past several years with Harvard and Tufts, and then compounding with Fallon exiting the commercial market. This means inherently that customers and employers have fewer options, and we have a smaller purview of companies to choose from. There have also been changes over the past several years in mass health reimbursements, which have resulted in providers charging more for services in the commercial sector, therefore another factor driving up health premiums and rates. The Massachusetts healthcare system is also experiencing financial challenges across many of its major hospital systems, particularly since COVID. We saw an example of this through the Steward Health collapse and subsequent acquisition by Boston Medical Center. Moreover, a depletion of healthcare professionals across hospitals is exacerbated by burnout, especially impacting nurses, causing a shortage across the Commonwealth. In some cases, this has limited access for care for patients and increased pressure on existing staff operating already under extremely tight administrative margins. Massachusetts has also seen a number of continued mergers and acquisitions across healthcare and hospital systems, with healthcare systems and/or even insurers absorbing smaller hospitals and healthcare practices. These types of widespread mergers and acquisitions that continue to persist can lead and have led to monopolistic dynamics, ultimately reducing competition and driving up prices for consumers and insurers. And lastly, there is a growing disparity in the Commonwealth between rising health care premiums and stagnant wages. As premiums increase faster than wages, more individuals struggle to afford necessary health care, leading to further financial strain on the healthcare system in Massachusetts. And then, as you saw in the report and in the presentation, we also have delved into what's going on specific to health insurance, not only in Massachusetts, but also across the United States. Understanding these drivers is essential as the basis for why costs are rising and where an employer like Duxbury can potentially make an impact on managing these expenses both in the short and long run. For example, demand for healthcare services continues to rise due to an increasing prevalence of acute and chronic conditions such as cancer, diabetes, heart disease, behavioral health, and obesity. All of these conditions tend to be a top cost driver in some way or another for municipalities. An advantage of being self-insured is that the town can explore specific programs and/or point solutions that directly address and manage these conditions to reduce costs. To reduce costs. If you go to
Slide 2.
yes,
Back-
where
no,
it says
back down.
rising, back up one more, where it
There we
says
go,
rising
right
costs.
there.
There you go.
Thank you.
Thanks, Lauren. Good job.
Where was I? So I was saying that an advantage for the town being self-insured is that it has the ability to explore specific programs and/or what are called point solutions that effectively directly address and manage conditions to reduce costs by ensuring prevention, adherence, and driving care to quality and cost-effective providers and facilities, which is an important path forward. Another factor is related to aging populations. As the population ages, there is a higher need for medical services and long-term care-related expenses that are becoming more pervasive, particularly with complex conditions. Another very significant impact on costs is attributed to new technologies and treatments, which certainly create more options and access for patients, but also have led to the demand for services and thus added expenses for providers and the overall healthcare system. As discussed, we are seeing sharp increases in hospital costs, particularly for outpatient care and emergency room visits. This has and will continue to lead to higher operational and medical-related costs. This is an area where Duxbury has and will continue to leverage different steerage, telehealth, and urgent care-focused programs to direct care in cost-effective manners where appropriate. And finally, it's simply becoming more expensive for providers to deliver care with these technology, administrative, and operational demands that are continuing to evolve year over year. All of these reasons contribute to why insurance premiums are rising at a rapid pace. And when we look at the medical side of healthcare administration, particularly over the past 2 to 3 years, the impact that they have had. If you don't mind going to the next slide, please. And here we look at pharmacy, which has been a significant portion of the health insurance premium. And I just want to touch on a few points here. The increasing prevalence of chronic diseases directly contributes to higher pharmacy spending, often necessitating more expensive treatments for patients. We are seeing particularly high development costs associated with these specialty drugs, which require significant investment in research and development, leading to higher rates. We have also seen the widespread challenges publicly related to GLP-1 medications for weight loss over the past 24 months particularly, and the unprecedented cost impacts these medications have had on employers in both the public and the private sectors. While there is no doubt that these medications provide therapeutic benefits for members, most public employers and insurers in Massachusetts have experienced such significant financial hardship from these GLP-1 related expenses that most have and will continue to eliminate these off the formulary. For example, in calendar year 2025, Duxbury had 7% of its members account for 25% of total pharmacy claims related to GLP-1s prescribed for weight loss alone. The expenses linked to GLP-1 medications for weight loss have notably impacted Duxbury over the past couple of years, contributing to higher rates over the past 2 renewal cycles compared to earlier years, as we'll discuss going forward. This decision, effective July 1, by Blue Cross Blue Shield of Massachusetts to remove these medications from the formulary is expected to provide Duxbury with some financial relief for FY27. Although most employers and insurers are limiting access to these types of medications, not only for weight loss but for other specialty meds, surely there will be more advances like these in the future that will offer and present a similar dynamic. In response, the town has contracted with a pharmacy consultant for FY27 to better negotiate Duxbury's pharmacy contract terms with Blue Cross and Blue Shield of Massachusetts, and to employ some programs that offer ways to purchase these higher cost medications and infusions at lower prices. It's important to note, having said that given Duxbury's size being under 1,000 subscribers and currently being contracted with Blue Cross Blue Shield, there are limitations on what we can do to manage the pharmacy program directly. But we have taken a positive step forward. These efforts have led to more favorable contract terms potentially for FY27, which are expected to generate a cumulative savings of approximately 10 to 15% on pharmacy-related spend in FY27. If you don't mind moving on to the next slide. So I know in the report there's a tremendous amount of detail that we provided on the different market options that Duxbury has in the past considered in terms of how it's administering its health and pharmacy benefits and how we will move forward with that evaluation. And essentially, we've gone through, as we did last year, the difference between being self-insured and fully insured and then being with a joint purchasing group. Self-insurance, just as a high-level overview, means that as the employer, we take on the financial risk of providing health benefits to employees. At times, we are utilizing the accumulated funds that we have accumulated in the trust fund when there are unexpected years of higher claims cost activity. Being self-insured, you are in that position to have to reconcile and sort of ride out those years where you have high cost claimant activity and lower where you have surpluses. The town, objectively, in our experience as working with almost 70 communities across the Commonwealth, has done a stellar job being self-insured. It's set up in a way with its insurance advisory committee and the resources within the town that it has been able to effectively and successfully manage self-insurance through these times of ups and downs. In contrast, a fully insured model essentially means you are working through the insurance carrier and that carrier is paying the premiums. While this offers a level of certainty, the expenses and the premiums and the rates are very high, and they are notably higher in this climate. So this has not necessarily made sense for the town to pursue. The third option is to contract with a joint purchasing group. If you don't mind going to the next slide. Joint purchasing groups, typically when you're a part of one, the risk is spread over the pool, and decisions are made in the interest of the entire pool as opposed to the individual community needs. This works for some communities. Other communities are better off independent. It really depends upon what the risk pool is for the specific entity. Fortunately for Duxbury, the risk pool has been relatively stable, even with the cost fluctuations over the past couple of years. So we have to look at it in the aggregate, not just one year over another. Having said that, we have looked at several purchasers in the past and will continue to evaluate those options as the healthcare landscape evolves. Last year, we did a very thorough analysis of the GIC. Overall, it would have cost more money to go to the GIC in various capacities. There are also other joint purchasers that are statewide, such as Maya, and other regional purchasers, such as the Mayflower Municipal Health. All of them are different in terms of their exit and entrance policies, in terms of how they procure and administer health and pharmacy benefits as well. So we will continue to look at those as we move forward, but have in the past. And I think I'm going to turn it over to my colleague who's going to talk to you about the trends that we're seeing within the municipal market with different rates and why it's made sense for the town to remain self-insured in a 5-year look back.
Can I ask you a question
Yes.
before you, just on the three options and the weight loss drugs specifically? So the Blue Cross made the decision that it's not going to cover those high-cost drugs, and I think about that because I feel like that might be a good short-term decision financially for them, but in the long term, I think the taking of those drugs may actually help people's health and that they're and limit or lower the costs moving forward. So that being said, in the scenario where of the self-insured, do we get to make as a community those types of decisions as to whether you would cover something or not, or is that still taken out of the community's hands?
Well, Blue Cross has made the decision to eliminate the GLP-1s for weight loss off the formulary for July 1. Yes, as a self-insured entity, you have the decision of looking at adding them back in as a rider. Financially, that is not in the best interest of the town, and I know Mariana, as part of the renewal and her leadership there, did an analysis of what that would cost, and it just doesn't make financial sense. To your point, you know, looking ahead, the sort of fundamental problem right now with GLP-1s for weight loss is the lack of data. They have not been out for a very long time. I mean, in the last 5 years, they have really, come into play. So when you're talking about, if I'm on a GLP-1 and my cardiovascular disease is essentially either under control or cured, or my high blood pressure or cholesterol, really being able to step back and evaluating over a period of time, that cost-benefit analysis is just not there yet. And right now, in the short term, because of how significant these have impacted so many employers and insurers, that's why the decisions are made, because they're just not sustainable out of pocket. That could change down the line. I mean, we've seen, for example, with the elimination of these drugs nationally, the response from a vendor like Eli Lilly that makes Zepbound, for example, right away their response was to create a direct-to-consumer program that happens to now be less than half of what Zepbound would cost under an insurance purview. So you've already seen the prices come down in the direct market, and hopefully with the efforts that are going on, that will penetrate into the insurance again. And I would say that we are absolutely, open to doing an evaluation again when the prices resolve, if you will.
Thank you. So the broader answer is that we do have more control, or some control over kind of smaller issues like that. Okay, thank you.
Just give me
Yes.
some financial context specifically for Duxbury.
If you don't mind, just come up to the microphone so people can, that are, we can hear you here, but it's the people at
No
home,
problem.
right? Thank you.
Just to give you a little bit more financial context exactly for Duxbury's situation, it would have been at least an additional 5 percentage points of an increase. And the reason being is the cost at Blue Cross, while the direct consumer product prices are coming down, with Blue Cross, with their PBM being CVS Caremark, those prices are not. And to couple that is the oral version has also come out to the market, and CVS Caremark has made it clear those prices, despite it being a pill form and less effective than an injection, will also cost the same as an injection, meaning utilization would only increase and costs would only increase. So we looked at it as, for your specific experience and current utilization, at a minimum, we would have added at least 5 percentage points to your renewal.
All right, thank you.
You want to go to the next slide? So while the FY27 increase for FY27 at 12% is higher than historical increases for Duxbury, it is important to view this in the broader market context. Across Massachusetts, we are consistently seeing medical trends of 8 to 12%, and that has been relatively flat over the last 5 years. What has really driven the increases is the pharmacy trends with the specialty medications and GLP-1s that Danielle has talked about in the 14 to 18% range. When compared to other municipal entities such as Maya, the GIC, Mayflower Municipal Health Group, Duxbury has generally tracked more favorable over time. There have been years where Duxbury has significantly outperformed the market, including minimum to flat increases. So it really reflects a strong claims increase and disciplined plan management. That said, what we're seeing now is less about one plan or decision and really more a systemic pressure in the marketplace that is really causing increases across the board. The other thing that I think is important to know is different entities have different ways to subsidize. So if you are self-insured, if your trust fund is healthy, you can offset artificially your increases. So that's something that Mayflower has done in the past. The GIC does not have a trust fund. It runs on an annual budget. For this current year, they actually were running at a deficit and needed the state to provide additional funds to make sure that they were able to balance their budget. So that also adds some additional context and complexity, but from a broader market dynamic, all municipalities are really navigating in the same level. We go to the next slide. So building on the prior slide, this view sort of simplifies the comparison into a 5-year average to help level set expectations. Over the past 5 years, you can see that Duxbury's average increase has been approximately 4.9%, which is notably lower than Maya at 7.8% or the GIC at 8%, and also favorable compared to the Mayflower Municipal Health Group. This is an important data point because it really reflects the town's overall financial performance and stability in managing its healthcare costs. In other words, despite volatility in individual years, particularly FY26 and coming for FY27, Duxbury has been operating from a positive of relative strength and a healthy trust fund, and that's really important to note. Yes, sir.
So the track record has been fantastic, 23 to 26, right? We've consistently, by being self-insured, been able to perform far better than the other communities. But I'm just trying to figure out why all of a sudden we're 12 and our competitors are beating us in fiscal year 27. What's the same pressures that we're experiencing, MIIA, GIC, Mayflower must also be experiencing. So what makes us different? Why are we at 12? They are 8.3, 8, and 10 respectively.
Realistically, it comes down to two things. One is different plan design options. So what their base rate is going to be different than your base rate in the plan design, meaning the value of the plan is going to be different. And two, it's simply your individual risk in your pool. So your members may be healthier or unhealthier at any given point than any of these pools.
And then made significant rate changes.
Yes, that's a good point.
I'm sorry, Jeannie, what?
They made significant rate changes the prior years.
Yes.
So again, their base rate with their plan designs went up significantly more in prior years, so it's a compounding effort.
And if I may just add on to that a little bit,
Please.
The other point of consideration is also the fund balance within the trust fund. And so what we saw in our experience over the past year was the significant impact of these GLP-1s and other claims that have caused a reduction in the trust fund balance. So this is the Health Insurance Advisory Committee balancing all of these risk factors, experience, claims, market trends, and setting rates that are effective for maintaining the balance in the trust fund as well as maintaining proper coverage for our employees.
Okay.
Thank you.
Okay.
Yeah, and I also just wanted to add that, that we obviously gave the averages for GIC and Maya. GIC was at 220 million?
Yeah,
Yes.
it shows the band. Yeah, because they do individual increases by plan, and they have the Medicare increases for July 1st as well. So their operations are a little bit differently. While here it's more of a composite increase, they have ranges for low and high. And same with Maya. They do both individual rating, but then they also look at their broader. So there could be some entities that are on the lower band and some entities that are facing that higher band of 14.4.
And
Because it's based on what they're offering their employees, then is that what you're saying?
That and also the individual risk pool in that specific entity.
Okay, got it.
yeah, and I forgot who mentioned the point of, being immune to the same challenges. They certainly have been. I mean, the GIC was in a deficit of somewhere, I think, around $200 million. but the GIC can go to the legislature
Right.
and get the money. So I think it's important to really put it in perspective that they have not been immune. Maya last year was cutting off new entrants coming in. So, it's sort of been, you have to look at the sort of cumulative, collective circumstance that this happened over the past 24 months.
And the GAC was going to make some really significant plan design changes also for FY27, and yet again, the legislation was able to step in and only ask that they eliminate GLP-1 coverage for July 1st.
Right, okay. So I think the message is we're trying to make sure that people that people listening in kind of feel good that Duxbury is self-insured, right? Because it's good for the employees, but also good for the residents, right? Because at the end of the day, they're contributing their tax dollars to this, right?
Yes.
Yeah.
Yes. And, as helping you as the fiduciary, everyone in this room, manage the health insurance, this is something that we know is a moving target and that we are constantly evaluating.
Mike, did you have a
And I
question?
think the fact that we can have the ability to look at the pharmacy and employ these specific programs that help control costs by, offering alternative purchasing strategies for
Right.
some of these drugs. These are things that we cannot necessarily do on your own as Duxbury if you are with a joint purchasing group or in a fully insured model.
Yeah. Okay, thank you.
In your renewal process or when you're evaluating the options, are you able to get quotes from these joint purchasing groups or from the fully insured group, for fully insured? Do we ever get quotes specifically for Duxbury, what it would cost?
We certainly have in the past. I know last year when I came on, a GIC analysis was complete. In the past, certainly we have gone out for different rates, through marketing processes. It is something that we will take a look at again next year. I mean, typically we don't do that every year, but certainly we'll see where things are. And, I think if you don't mind going to the last slide, I think this is a good transition to sort of conclude this, but, kind of the next one, please. Our path forward here, and that is, we're going to continue to review the alternative plan options, really try and do whatever we can on the prescription drug front, as I've talked about. We want to look at other things like evaluating an opt-out program. Many communities are looking at that and the value as another lever to pull. Promoting member education, implementing some of the things that we talked about steerage and other programs like Teledoc, telehealth, things that Blue Cross offer that will help the member become a better informed consumer. Because that is where we need to go next, right, is to touch the member because they're a stakeholder as well in their care. So, I mean, these are things that we're going to consider, and also alternative plan designs. Can we look at something like a high deductible health plan and see how that complements the existing plan design as well? So these are sort of things that we're going to take and move forward and make sure that Duxbury year over year is in the best position it can be.
Mike?
Okay.
I think from the big picture here, when we sit down and we look at the budget, a 12% increase is crushing to our razor-thin budget. Everybody in this community is well aware of where we're at as a community. What they aren't totally aware of, maybe until they bore down on the details, is this is the big driver in our budget. And I would certainly like to know if there are other options. In addition to wanting to know what those other options are, you said at the beginning, we take on the full liability here. If people get sick, we also take on the full management of it. And I know this is a big part of Jeannie's job and her staff to manage this. So I certainly would like to know what the options are as we keep going forward in these years where we have these razor-thin budgets, and because that's.
So you mean quotes from other companies like?
I think it's incumbent on,
Interpretation
not
would
just
be
ranges.
wrong.
I don't need to know what these ranges are. I'd like to know what it would cost Duxbury to go a different route. I mean, 12% is going to be really significant next year. I know we haven't gotten the snapshot for next year, but I expect it's going to have an impact. So, and I don't want to take your words away, but I'm guessing 12% increase in our already large health insurance costs.
So this increase that we're talking about would be in effect for FY27, which is the budget that we've already approved at town meeting.
Okay.
And so what you're referring to is
28.
future. And, you know, we know that these costs are volatile. We know that they are ever increasing. We're doing, as Danielle and the team have said, we're doing everything that we can in order to contain those costs. But there's got to be some higher level solution between state regulations and partnerships between the insurers with the hospitals, other contracts that get negotiated that impact these cost drivers. And we are hoping for certain that we're not going to be seeing another double-digit increase in future years. We're hoping that this is an anomaly in order to correct for some of the experience that we saw this year, with, in particular, related to these GLP-1 drugs. I don't know if you heard the statistic, but Danielle said 7% of our subscribers accounted for 25% of our pharmacy costs,
Heard
which is significant.
Yeah.
And that's what had an impact on the trust fund balance last year. So that's what we are addressing in setting these rates this year, as well as all of the other things that she's mentioned with cost drivers.
Could a trust fund balance ever be used to buffer going into another plan?
To transition into another plan?
It doesn't just evaporate.
It does not, no, it does not evaporate.
Correct.
Oh, good grief,
Could you
no.
use it in the years going forward to?
Absolutely. I mean, the purpose of it is to support the health insurance program. And so whatever that program looks like, we would, react and respond accordingly.
Yeah. Hopefully this goes back to the zeros and the 2% increases.
In the
but-
single digits.
A lot.
I want to caution about zeros and sort of holidays on rate increases. They're not a good idea. Because even though they may provide some sort of temporary relief, we know that in this game of life, costs always increase, right? And so as long as in those years where we may not need as large of an increase as we saw on some of these charts, that if we continue to modulate it in a conservative fashion, that we will protect both the employee and the employer with respect to the trust fund.
If I may, Amy,
Yes.
just
Oh,
want
sorry, yes,
to
thanks, Mike.
contribute a couple of cents here. There are always trade-offs with any decision, and Mike, I take your point about looking at alternatives, and we do that. And when I say we, I'm one of the members of the committee, we do that regularly, and I just want to shout out to a number of folks who are here tonight. I'm looking at Betsy, and I see we have a couple of folks in the school department in the back. We've got Tony and Lisa, thank you. Thank you. Yeah, there's a whole bunch of folks in here who meet on a monthly basis and really drill down into the weeds. And one of the things that we're able to do in Duxbury is we have a number of levers available to us to really customize the program that's available to our employees. And if we go to a different model, whether that's Maya or whether that's Mayflower or something else, you give up the opportunity to adjust those levers and you put into a bigger pool. What you get is certainty, for sure, but it's maybe a larger number that's certain that we don't want. So one of the benefits that I see, and that's not to say that we shouldn't be looking at things continuously. I want to point out that this group is on a monthly basis, if not more frequently, that the alternatives, such as they are, aren't solutions, unfortunately. It's just which avenue makes the most sense. And if we didn't have the benefit of HR, for example, being able to manage this on a daily basis, we wouldn't be able to do it in-house and would have to go out to another model. So this is all stock reality, unfortunately. It's nothing unique to Duxbury. I think what is unique to Duxbury, however, in this discussion is the way that this town approaches the cost and 12% is a lot, Mike. I agree with you. But here comes the but. It could be worse. And I know that's not a great consolation to folks who are paying the bills. But it's I'd like folks to come away from this discussion with an appreciation for the fact that even though there's a lot of red and bad news, there is some good news to be found here. I'm the eternal optimist in that the town, through a number of folks sitting here tonight, have done a lot of hard work to make sure that number is as small as it can be. And to your point, Mary, it's not zero, and we make no illusions that it's going to be a small number. It's the reality of what we're living in for all the reasons that Danielle mentioned earlier. And we will continue to manage at a very granular level. And there might be a point, Mike, to your point, that we decide to go a different way. That's always on the table as an option.
Well, this was very informative, and we certainly appreciate all of this group's time and effort. I learned some stuff, and I think it was very helpful. Any more questions from the board? Anyone in the public have any questions or comments? And this doesn't require a vote. This was just an informational session.
Present the vote.
Oh, okay, great.
You want to step up for that?
Thank you.
Thank you very much.
Thank you very much.
Yeah. And thank you to the insurance committee as well, so.
Yeah,
Thank you very much.
Really, that's a labor of love there. Thank you. Jeannie?
Okay. Good evening. I'm Jeannie Horn. I'm the Human Resources Director. And I am following up with the details for the Select Board. So as I stated in my memo on Friday, which was distributed to all town and school employees as well, the town of Duxbury provides benefit-eligible employees and retirees and their dependents with a variety of insurance plans related to education and related education and wellness opportunities. Together, we have demonstrated our ongoing commitment to long-term health, preventative care, and emergency room alternatives such as the Blue Care Line, telehealth, urgent care, minute clinics, and others which help contain our overall health insurance costs. So some of you may recall the last time we had a double-digit percentage change in our health insurance. We heard loud and clear from employees that they wanted us to not provide 0% increases going forward, that they wanted us to provide incremental adjustments to the cost of our benefits so that we could, to a large extent, avoid the double-digit percentage increases that we're facing now. So I do think that these are challenging times. The presentation went very thoroughly through the reasons for that. So there's acuity, there's the frequency of medical care, and there's specialty pharmacy that's really driving these costs. So I do think that we're in a bit of a different place. But I say that because our community has done a great job of utilizing our emergency room activities or alternatives. And that's something that our employee population learned because they were invested in these costs. They're invested in the plan. They're invested in what we currently have. So we plan to work with HILB, our consultant, to provide training opportunities to employees to learn more about how to save on our health insurance costs. And those include a arrangement that we have with PBIRX, which I've mentioned before. They're going to help us analyze our pharmacy benefits, and they'll work with Blue Cross Blue Shield to make sure that our contracts are being adjudicated in accordance with what we've agreed to, and they'll be doing audits in terms of the administration of those plans. So I think that's positive. So as detailed in the Health Insurance Outlook Report, the town's insurance committee meets monthly, and Brian talked about who is on that committee. To provide continuous financial oversight, our self-insured health insurance model has delivered a rate of increases in costs that are generally lower than the models used in our competitive set communities, such as the Group Insurance Commission, Massachusetts Interlocal Insurance Association, and the Mayflower Municipal Health Group. While with our self-insured model, we pay our medical claims directly rather than through a fully insured premium. You may have seen this in Rockland recently. They realized that they were paying a fully insured premium to Blue Cross Blue Shield. They didn't have any control over that cost. A fully insured plan is something that we costed out with HILB's help last year. To ask that question, would we be better served in a fully insured plan? The answer was no. It was going to be a much more expensive option, and then Rockland actually ended up leaving their fully insured plan, and they ended up going with another provider. So that's just an example of how we're making sure that we're being as fiscally responsible as possible. We also purchase stop-loss insurance to limit the town's liability regarding high-cost or catastrophic healthcare claims. And we hire a third-party administrator to provide network access, claims processing, and other administrative responsibilities that are outside the scope of what you would want your HR department to be doing in terms of HIPAA and other considerations. So this model has provided the town with more autonomy over plan design and the management of health insurance benefits for our specific population. I won't go into the key cost drivers that are in this memo because we've already talked about those. So as a result of the trends that we've already reviewed, the Insurance Committee continues to explore opportunities. We will do this on an annual basis so that we ensure that we are in the most advantageous model for the taxpayer and for the employees. And in order to contain healthcare costs, and we recommend the following effective June 1st, 2026. So that's for fiscal year plan that begins July 1st. We take deductions a month in advance. So it is recommended that we have a 12% rate increase for Blue Cross Blue Shield health insurance plans, the PPO Blue Care Elect, and the HMO Network Blue New England. Again, the town pays 75% of that cost, and for employees and 50% for retarees. And just to put a finer point on what we were talking about with the GLP-1s, so if we were to have a rider with GLP-1s that would override the decision that Blue Cross Blue Shield made, so that would make potentially our increase at 20%. So it would have been a 20% increase. The recommended increase for without the GLP-1 rider was 15%. So we are taking some funds from the Health Insurance Trust Fund, that's what it's there for, to address that very high recommended increase, and in order to bring it down to a 12% increase, just to put it into perspective.
It's good
so
context, right? So just to
Right.
repeat then, right?
Right.
So it would have been 20%
It would have been-
increase
right.
if we would have included the GLP
Rider.
on medication.
Yeah.
We're not including the GLP on medication, so it reduces down to 15%. That would have been it. However, our trust fund is robust enough that we can basically reduce it from 15 to 12%.
Right, and that's what it's
Okay.
there for.
All right. Thank you.
Yep, you're welcome. And the good news is there's no rate change at this time for the retiree plans for MedX2 and Medicare PPO Blue Freedom RX. There's no rate change for our Delta dental plans, and there's no rate change for Boston Mutual. And then the memo goes on to say, to reiterate what we shared with employees several weeks ago regarding GLP-1 drugs, and that we won't be covering those anymore. And it provides additional resources for people to explore if they are faced with that reality, and it gives them some ideas about where to go to find some alternatives.
Thank you. Questions for Jeannie?
Great work.
Thank you.
Questions
Thank you, Jeannie.
from the public? All right, hearing nothing, I will take a motion.
I move that the Select Board accept the proposed group health, life, and dental insurance rates effective June 1, 2026, as presented.
I have a motion. Can I have a second?
Second.
All those in favor?
Aye.
Opposed? Abstentions? I will
Abstain.
abstain. Thank you very much for all that hard work, you guys. Appreciate it. Appreciate the knowledge.
Thank you very much.
Thank you.
Next item on the agenda this evening is a discussion and vote on a temporary access license for study and non-destructive testing of the Powder Point Bridge. And this is being presented by Alicia Babcock. Do you want to start it off, Randy?
Thank
Sure.
you, I appreciate that. Yes, I was going to ask you, please. So, back in December of '25, which wasn't too long ago, I, along with Brian Glennon, Mary McKinnon, Alicia Babcock, Sheila Scarzi, and two of our engineers from SGH had a meeting during which we discussed the idea of the wood concept in some fashion for the Powder Point Bridge. And that could have meant, complete replacement all the way to restoration. And during the course of that conversation, a question had come up that was asked by Alicia, having to do with whether or not Mass DOT would consider an alternative, that is wood, for construction of the Powder Point Bridge, including the pilings. And so I asked Marco at Mass DOT, who is our point person, that question, and in turn, he responded that the short answer is no. He indicated that any repaired work that would require dewatering with cofferdams would likely require significant environmental permitting, and it could make the repair infeasible. The repair is infeasible. And all of that, we concluded that given the information and the associated variables, including but not limited to the costs to the town, coupled with the board's previously expressed intent on moving forward with the Mass DOT project currently contemplated, we didn't see a need for discussion at the board level pertaining to the advancement of the proposed suggestion in the scope listed by, in the scope of services presented by WRD, which is Wood Research Development. So that sat for a while, dormant for a while. But during the course of the conversations from December all the way to, call it the beginning of April, it was in the back of our minds that we wanted to make sure that we did hear from everybody, having all viewpoints and angles having to do with the Powder Point Bridge, meaning it wasn't just going to be Mass DOT coming in and saying, hey, town, here it is, pick it. I knew that, and I'm looking at you because I know, Amy, you had expressed an interest, and I had not forgotten that, and your voice was in my head saying we needed to make sure that we incorporated every different angle. So with that, I reached out to Alicia and said that some time ago the board had expressed an interest in making sure that all parties were heard from regarding alternative options with respect to the Powder Point Bridge. Given that, I asked if she and or Dr. Tingley would be interested in having an opportunity to have that discussion. And so we did. We had the discussion, and included in that conversation was myself, Sheila, Fernando, Amy, you were there, Alicia, and 2 engineers from SGH. And so we had the conversation, talked about a number of things, which
And
was...
also, they're missing in, was there,
Oh, yeah.
Frank.
Oh, Frank, I'm sorry. Hi, Frank. Yep, Frank was there too.
yeah,
So we met and talked about a bunch of different ideas, and the idea was proffered to have someone, Alicia, or whatever the name of the organization is, forgive me, it's Save the Bridge or Restore the Bridge, to donate as a gift, and also Dr. Tingley, donate as a gift to the town, $48,000, which would have been the cost of the study. So what we did was met and talked about that and said, yep, that sounds like a good idea. So what I did was I ran it by council, and council has said that the better idea is to use a license agreement. And in fact, so it changed what we had originally had a conversation about, and as recently as today, I said to Alicia, and she understood, that after our meeting, I discussed the gifting process with town council, as is customary in cases such as this, and per the advice of council, we're using a license agreement with specific conditions, as it will help to ensure that the project is performed in the manner with which we all agreed, and to ensure that the town is protected in terms of its completion. Council has suggested that it would be better to have Save the Powder Point Bridge organization act as a licensee with an authorized individual signing off on the license. In this case, there is no applicant per se in the sense of other licenses issued by the town. This is a license to enter property for a particular purpose, not a permit to undertake some regulated activity. Further, council was in agreement with the idea of combining 2 of the original clauses in the agreement, let's see, condition number 1 and condition number 8, as they do appear to be related, and as such, I combined them in the document. And with respect to liability for curious members of the public, which Alicia had raised concern with, I replied that the licensee would be responsible to undertake the work in a safe manner and would be responsible for claims by individuals harmed by that work. That is the purpose for the indemnification and the insurance. Basically, the town's off the hook if somebody comes down to take a look and gets hurt. And they have to provide a certificate of insurance, which Alicia forwarded to me this afternoon. And finally, with regard to what the final version of the license, that will be up to the board to decide this evening, and we'll make whatever changes may be necessary. If necessary, we could make those tomorrow, if in fact the board decides to move forward with that. And I do have a copy of the signature pages with me, and if there are necessary changes needed to the license, I can make those and have everything ready to go tomorrow. So that's kind of where we are, but I know that Alicia probably wants to, does that help? Does that
Yes, no, I think,
give you the nutshell?
yep.
That's where we are.
Does anybody have questions for Rainey before we jump to
the
Alicia?
form of license itself, that's from council, right?
Yes, sir. Yeah.
Thank you.
Mark Rich.
Alicia, Good evening.
Hi.
Thank you.
I don't know that I have a whole lot more to add. Rainey explained it very thoroughly. It was great. We are very, very happy that the town is open to hearing what a wood expert has to say. We think it's really important to have all the data, just like you. And we've got a lot of people that would like to contribute to that in the form of a donation through the Save Powder Point Bridge 501c3. And so we are in a position that we can execute this pretty quickly as long as you agree to grant us the license.
Great. Questions? Yep.
Yeah, I think, Alicia, I think it would be good just to, that, what's the deliverable, right? So basically, you've got a group of citizens got together and you're donating along with Dr. Tingley, $48,000 worth of work.
Right.
You'll come in and do that work, and what will be the product of that work? What information will we receive?
Okay, it will be a level 1 inspection. It will include some non-destructive testing, and there will be a report that will be generated from those findings. All of the data that they collect from under the bridge will go to their lab. They will interpret it, and Dr. Tingley will put it into a report, and then he will come to Duxbury on a date to be determined. I mean, we threw around a few dates, but it would be probably sometime in June, I think. And he would come and present to the select board from that report and answer any questions that you have.
Right.
And in addition to the information that he would present about the bridge itself, we would also have a general idea of what a plan would look like to repair it and what those associated costs would look like, and maintaining a structure like that. How does that look? What would some of those costs be? You know, we will get as much data in terms of the cost as we can. It is a level 1, so not every single pier will be touched, but we will get as much information as we can, because we know, you know, I think the public and the select board is very eager to hear, you know, what some of those numbers are, because there's really nothing to compare to right now, right? So,
Right.
so that's what we're hoping to achieve by doing this.
A detailed repair and/or restoration cost estimate, an expected life estimate for the Powder Point Bridge located at these premises, and an annual maintenance repair cost for over the 70 years, right? So that's going to be the deliverable
Right.
of that work.
Right.
Okay?
Yes.
Rainey has a question.
Well, actually, I was going to augment what Alicia just said. So in your packet, I think you have a copy of the access license, and in there are included, in your version, there are 8, but there are actually 7 conditions. And if you don't mind, this is what they are.
Yeah.
So the licensee shall ensure that the work deliverables include a detailed repair and/or restoration cost estimate, an expected life estimate for the Powder Point Bridge located at the premises, and annual maintenance repair costs over 70 years. That's the one Fernando just read.
Yeah.
Number 2, the licensee shall schedule a pre-field work meeting with Simpson, Gumpertz, and Hager to discuss a technical and engineering approach, ensure alignment on scope of work, expectations prior to the commencement of any work, and to ensure that a Massachusetts licensed professional engineer is involved in the work. Number 3, the licensee's presentation of findings shall occur at one of the following future select board meeting dates: May 11th, June 1st, or June 15th. Number 4, the licensee shall provide a Massachusetts licensed professional engineer stamp on all deliverables. Number 5, the licensee shall coordinate with the licensor's Department of Public Works and other relevant parties to ensure appropriate oversight by the licensor, and to ensure that the licensor is present on the premises during the work as may be required. Number 6, the licensee shall provide insurance certificates as specified below and all necessary documentation before the work begins. And number 7, the licensee shall provide a schedule of the work to communicate with all parties to ensure that their findings are ready for one of the select board meeting dates identified above. Now, for all that, that's that is the scope and the conditions of approval that would be borne by the Wood Restoration Bridge Group to the amount of $48,000. As part of this, SGH, our engineer,
Yes.
needs to be on site, and to pay for that, that's something that the town would have an expense in the amount of $10,000. We have the funding to do it.
But most importantly, the reason why that's really important is SGH will provide a peer review,
You bet.
and not a peer as in PIER, but PEER. So basically, we'll have, obviously, Dr. Hingley and WRD will provide an estimate, and we'll have the ability to have our own consultant, SGH,
Yes.
to go ahead and, like I said, do a peer review
Cindy.
on
Yeah.
that work.
So where is that 10,000 coming from?
So in terms of funding the town's portion, there's essentially four options that could be contemplated. The first could be a reserve fund transfer, but the likelihood that this type of expenditure rises to meet the criteria for a reserve fund transfer, and the criteria are that it's extraordinary and unforeseen, may not meet the qualifications for the Finance Committee to support it. So a reserve fund transfer goes in front of the Finance Committee for their review and approval. So that is one option if the board wishes to pursue that. But again, there's some qualifications associated with it. The second option is that the FY27 budget that is in effect for July 1st includes professional services in the town manager's budget. So it's a new line item that was added to the FY27 budget for this very reason when these situations arise and we are looking for funding sources. However, to utilize that, those funds are not available until July 1st, which would mean that we would have to delay this until that budget became in effect. The third option, which is the most viable option if this board chooses to pursue doing this project, would be to use the matching grant funds account that was appropriated at the last town meeting. And this would be an allowable use because this is essentially a $48,000 project, gift or grant that is being proposed to the community for which there is an associated town match of the $10,000. So those funds are currently available for use, and that would be the recommendation, again, if the board were to pursue it. And then option 4 is to not pursue the project and to do nothing, and in which case, that needs to be contemplated because the end result with respect to the Powder Point Bridge would be we have the state who's offering $170 million to build a bridge to a private beach versus the town bearing the cost of replacing it or repairing it with a wooden bridge. And we don't know what the costs are. I understand that this is the point of trying to understand what those costs are. But regardless of what those costs are, we need to determine whether that is advisable to fit within the scope of our existing capital program. So we know that we are facing very large-scale, very expensive capital, projects with our existing infrastructure, and the fact that we have the state and the federal government willing to provide essentially a free bridge to a private beach is something that we cannot take lightly. And I think that many of us would be very hard-pressed to recommend funding locally an alternative to that.
Yeah. No, I think the issue is understood, Mary.
Okay, so this is a $10,000 investment to get a quote.
Yeah, to get a quote.
Get a quote.
At the end of the day, is essentially, I would not support going forward with the license if we did not agree as a board to have this peer review, because then we would just have one person's word, so to speak.
Well, I think that as we have gone through this process, we have maintained that we need to understand what the options are for the bridge and to have an understanding of what are associated with those costs so that we can get the necessary feedback from the community on how we're going to proceed. So the fact that this group has donated $48,000 in which to get this study done is very helpful and very generous.
24,000.
So, and the,
Then Tim was
yeah, and,
together.
yeah.
If we went forward with the study and you took $10,000 from the matching funds, which, you know, those are hard fought for, could you then, July 1st, reimburse that fund with the town managers?
No.
And so my other question then to follow up is that this particular project, were we to vote to have this wooden bridge, and the restoration means a new bridge, is that correct?
To be determined. No,
it's
restoration.
Repair and restoration.
We don't
No,
know.
we
So
don't
there's-
really know.
We don't know what restoration means.
Not replacement.
Not replacement, it's just the same bridge that's presently there with stuff added.
I'll show you.
Yeah, okay, so not a new bridge, okay, and, so the expenses to that would be the repair and the ongoing yearly expenses of maintenance, thank you.
Yeah.
So, my last question then is, what is, and maybe this is a better question for after, you know, this decision, is what is the final process? Have we decided how we're actually going to make this decision?
Yeah, the board will take a vote. You're going to weigh some options. You're going to see if the wood option
Right.
is viable.
Right.
And
So, I mean,
you've got two options right now in front of you. Option one from the state and option two.
Right, so that's the
And
final.
that would be rendered by the board sometime in June.
Okay, so we are the final decision makers.
That's correct. You are.
Mike?
Could we have the PowerPoint advisory group back here possibly in May?
Sure.
I know that they had sought a number of waivers, and I don't know if those had been accepted. We did get a presentation back in February, but we haven't seen them in months.
I have no
And
idea as to what they're recommended, and maybe
Yeah.
they need this
not
information
for
as
want of
well
wanting to be in
before
here.
they make a recommendation.
I know that they want to be here too, so if we could get them in May, that would be great. So we can hear what they've been fighting for as well. Because I don't think this is a option one, option two.
Right.
I think there's still a lot of opportunity here for negotiation.
There was.
It was.
On that meeting.
Yeah, I think you're exactly right, Mike. We need the PowerPoint Bridge Advisory Committee to come and present. They've worked extremely hard and have pushed DOT as hard as they can to get these waivers in there. But I'd like for them to come and talk. Ed Mayo's put together kind of a summary of where we are at, where we got to. So I think we've got to somewhere in a
I
sense.
think we're about 95%.
Yeah, there's no more to be done. I think we're at 100%. I think Ed's going to work on some other stuff with regards to the wood decking, but that's highly unlikely.
Yeah, I just think
We'll
that,
have Marco come in too.
look, I think this is the biggest thing on our plate for the next year or so.
Yep.
The more times we can get this on the agenda, the better. The more
Absolutely.
publicity we can get, whatever options are out there.
More public weigh-in.
I appreciate all the work that's been done,
Yeah.
in these meetings and these advisory groups. The public needs to hear it.
Well, if we're making a decision in June, which is what I thought I heard,
Yeah, I think it's
Rennie,
good, yeah.
then, we have to step up the,
Let's ramp it up.
Yeah, Fernando,
So-
do you, excuse me one second.
Go ahead, yep.
Bless you. Do you remember if they were going to do another one, if Mass DOT was?
Isn't there a
Mass-
meeting Wednesday night?
Mass DOT is also looking.
Oh, I thought that was for the bridge, my
Route
bad.
three.
No,
For what?
that's Route 3.
Yeah.
My bad.
So basically,
Different bridge.
Got
the
it.
plan is for the PowerPoint Bridge the advisory committee to come and report to the board, so we've got to schedule that.
Yeah.
Also, we need to, there's Mass DOT are getting ready, basically to have another a meeting, a public meeting
Big
to,
one, and the final one.
the final one. I think we just need to agree on a schedule. I think
Yeah.
the best schedule to have is the PowerPoint Bridge Advisory Committee come towards the board
Yeah.
and to share with where we got to and where we've landed. At that point, I think it'd be good then for Mass DOT schedule their public meeting, and we'll also, by that time, be able to get the data, more importantly, the cost, right, of...
Wouldn't it
The-
make
the-
sense to get that before?
Oh, yeah,
the
let me just
DOT
finish,
meeting?
yeah. So at some point, everything needs to line up such that we know what basically it's clear to the public what the work of the Powder Point Bridge Advisory Committee where they've got to, where DOT have got to, right? So then we have an idea of the cost and what it's going to look like. We need to find out the cost of restoring and repairing and restoring the bridge, and then basically we have all the information that we need for the board to make a decision.
Can I ask a quick question?
Yes.
Is there a deadline that the DOT needs the town's decision by
Yeah, they had
Yes.
asked for it
before they
originally in May.
cancel or potentially alter?
Yeah,
They had asked for it in May, and then we
So-
pushed it back to mid-June. It was going to be June 15th, but I think it'll have to be after
Yes.
you guys
Okay.
hear from
Yes.
Alicia.
Yeah.
Yes.
And-
But I'll talk to
and
Mark. I'll get that.
I would like to clarify, just as we're talking
Well-
about the $10,000 funds that are being contemplated coming from one of the four pots that you discussed. If we were to utilize the new line item in your budget during the meeting that we had with the consultants, and again, that $10,000 isn't part of the group's donations because it's covering our
Peer review.
peer review engineer.
They're welcome to
So-
send donations to cover
so-
it.
Yes, they can.
We asked.
So, because of that, it makes sense that this comes from our pocket, if you will. But we did talk about a possible delay of getting the funds to our consultants after July, and they were agreeable to that. So if we
But-
wanted to use.
We're going with the grant.
So the issue is, if the services are rendered prior to June 30, those expenditures have to be recognized in FY '26, the
Oh,
current
okay,
fiscal
so even
year.
though you asked that, you found
So-
out we can't do it that
Yeah,
way? Okay, all right, sorry.
From an
That's why
accounting
we have Mary.
perspective, we will not allow that.
That's why you have a great finance director.
We were almost naughty there.
Yeah,
We went-
and I wasn't at that meeting.
And that's why I double-checked with her the next day. I'm like, hey, Mary, can we do this? She's like,
No.
well, no.
Yeah, no, you weren't there, so.
I'm sorry, Brian, did you want to
Oh,
go?
and just a few things. On the license itself, there's reference to an exhibit, which is the licensee's proposal. I don't know that I saw that. Can you point me to that proposal so we know what we're signing? And while you're looking for that, there's a reference to Mass DOT undertaking, oh, thank you. Mass DOT undertaking a bridge inspection. I'm looking at paragraph 6. This is the contingency or the date upon which this group would be able to do work. It's after the inspection. Do we have a date, or do we know what that date is likely to
Sheila
be?
Scarzy is online, and she may be able to answer that.
And the reason I ask is we're putting a timeline of June 30 on this, and I just want to make sure that you're going to have sufficient time between the bridge inspection and this deadline, so that we don't have to come back and amend the license later.
Right. So in anticipation of this, I have talked with Dr. Tingley, and we've put a placeholder on the end of the month to have him come out. It would be a 3-day inspection with a team of engineers, and that would give them enough time to go back, because they are, obviously, it's a busy time of the year. Now that the snow has melted everywhere, everybody wants their inspections done. So their calendar's pretty full, and so he's kind of reserved a little window for us so that we can make this June 15th deadline. That'll give them enough time to go back and do what they have to do and work around some things they have on their calendar.
Okay, so related to, and thank you for that attachment, Rainey, that's helpful. So just for the public's information, that's the breakdown of the costs and the work that would be proposed,
And it was also reviewed by SGH
which is our
peer-
consultant, right?
yeah, peer
Okay.
consultant.
and Sheila as
Eh,
well.
All right, and then just, Madam Chair, if I may, just two more things.
Yep.
One is, in connection with the inspection itself, Is there any expectation that there'll be any lane closures, bridge closures, any interruption with folks being able to cross the bridge?
No, there'll be zero.
Okay.
They're basically just walking around under the bridge. There's no danger to the public. They're basically just walking around under the bridge.
Okay, I
doing-
just want to
doing some
clarify, because
non-destructive
it's been
testing.
closed for a while.
Yeah.
It's open,
No, I
and we
know.
want to keep it that way.
No, it won't affect any traffic
Okay,
whatsoever.
great. And then finally, related to that, and maybe this is a Sheila question. Sheila, thanks for being here. Is there any, I guess, possibilities, too broad a term, but is there any likelihood any conditions might be found by this group that the state wouldn't have found in its inspection that might endanger the ability for the bridge to be open?
No.
I don't anticipate that. The bridge is currently being inspected by MassDOT this week. They anticipate finishing by Friday.
So
So if there are any issues with the bridge, we should find out
Right.
late this week.
Thank
So
you.
basically, Sheila, we're, just to remind everybody, DOT are inspecting our bridge twice a year because of the
Yes.
state of the bridge, right? Normally, they inspect the bridge every 5 years, is that right?
Yes, due to the condition of this bridge, MassDOT currently inspects it twice a year.
Right. And then basically, we'll recommend any work that needs to be done so that we can continue to use the bridge by vehicles and pedestrians, right?
Okay, Cindy?
Yeah, I
Thank
just
you.
want to make sure I have all the dates correct, because I'm a little confused now. So if Dr. Tingley is not able to come back until June 15th, is that what I just heard?
Yes.
Okay, and we're
To
going
present to us. So he's
present to
inspecting in
us.
April.
In this room.
No, I
He's-
understand. Yeah, I just want to get the dates. But that's also the date that you told MassDOT that we would have our,
He's
We
going
were
to kick
hoping,
that.
yeah, I'm
Hoping.
going to have to change that, yeah.
and that's something that you anticipate being able to change without any problem?
I'll have to ask. No, I do not anticipate it without a problem. I have to ask them. Because they're going, full steam ahead.
Right.
They have no reason not to. And they've
Right.
verified that with us a few times.
So that seems an issue. I mean, one of what we're signing here, if we sign this, is that one of the dates he could come would be June 1st, which seems would be a better date.
It's based on Dr. Tingley's
Well,
availability.
the three dates that are on here, Cindy, were the dates that Rainey had offered
They're board
because
meeting
there were
dates.
space on your agenda.
Okay.
And in order to turn it around in time to have, an adequate report done,
Okay.
and again, with his schedule, it's a hard push to hit June 15th.
Okay.
So-
All right. So we're going to have the bridge folks
May.
May, and then nothing until June 15th, and then MassDOT coming in?
Yep.
With their big presentation offsite, yeah, the one that they do.
Offsite, but after June 15th.
I have to
Yep.
coordinate that with them, yeah.
And then we have to make a decision with them before the end of the
Yeah, I
month.
have- again, I
probably.
have to
It just
coordinate
seems a
this.
little wonky.
I have to coordinate this with the state to see what their timing is and if in fact they can hold off until after June 15th.
Hope they might give us a little bit more time. I mean, I think that we really need community input. We desperately need that. This is a huge decision, and
Yeah, no, I agree, and we've gotten a
Wait,
lot.
wait.
We've gotten a lot.
Yeah, we have
Let's be
Yeah,
clear.
yeah.
Yeah, we've got.
Maybe what do you mean by community input?
but once we have the information, I think that it will generate, I think it'll happen all on its own. I think it'll be an organic thing. Once we start talking about this more and these groups come in and there are options, we're going to get a good sense of where the town is at.
May I address that? Just
Yes.
to, so we've had two relatively well-attended meetings with Mass DOT. There have been proposals from Mass DOT given to us there at the library, for anybody who'd like to see them on the second floor. At the last couple of select board meetings, I've asked during open forum that folks reach out to us with comments. Frankly, I haven't heard a lot.
haven't either.
I've heard, what I have heard has been all positive. And I won't sway the jury in terms of which way to go, but one particular alternative of the two has been a front runner from folks who have spoken to me. But when you say, I agree with you, I think we need community involvement. I'm just trying to Fernando's point, parse that out as to what that looks like in terms of
Correct.
what we haven't done that we still could do to get that remaining input.
What the missing information for me might be, and I think that you know it better than me, but I have no information as to what our advisory group, where the plan is, what they asked DOT
Okay.
to
Yep.
do, and what has been done or not done. What did that change? What did it not change? What are they recommending to
Okay.
us? So that really is such a missing piece of the puzzle for me.
Right.
So I think having that information along with here's another option, again, I think organically it's gonna start to declare itself. I
Right,
do.
so basically, so we will have a meeting of the PowerPoint Bridge Advisory Committee will come to Select Board. So people will know about it and then come along here.
Yep.
And we can hear their feedback,
Exactly.
which is good. So that's what you mean by community engagement,
Yes,
right?
yes.
And then we'll have the DOT will do their open house, and that another form of community engagement. We'll hear feedback. We'll hear people, chatting with us. Will hopefully send us lots of emails and reach out by telephone and send notes to town hall,
To the Clipper?
to the Clipper letters, and then basically we'll have WRD will come along with SGH, and they'll have their presentation, and we'll get feedback. So that's what you mean by organic.
Yes.
And so therefore, we as a board, Select Board, will get a sense. We'll also get a sense of financially where we are as a community,
Exactly.
which is really important. Back to Mary's point, but ultimately the decision that will be made on what we do or what the town of Duxbury does with the Powder Point Bridge in the future is a decision of the Select Board. Right.
Well, I just had as far as decision makers, will SGH be providing some kind of input on permitting? One of the things that struck me back in, October or so, was the point that no matter which way we went, they would still have to go through the same permitting authorities. Will SGH be addressed, like when they do their peer review of this?
Yep.
Will they say, here's the reality? You're
I
still going to have to go.
imagine.
You're still going to have to go through the Corps of Engineers. You're still going to have to.
This is what-
And this is the likelihood
That's
it'll
why
pass
we're,
muster.
that's why we have them on board,
That
is
doesn't
my
No, it isn't.
understanding.
We have them on board just to do the repairs to the bridge. They're not.
No,
here to do-
for the
With
peer
their
review.
peer review, with
For the
their
peer
We haven't
review.
asked anybody. Oh, for the peer review.
For the peer
Alicia's
review,
project.
yes.
For Alicia's project.
Yeah, I thought you meant
Because
like
I need to
DOT
hear that
project.
too, and the
No,
public
no,
needs to hear
no.
that.
And basically, you can ask that question of the Powder Point Bridge Advisory Committee, because they've talked about that with DOT, and with DOT turn up, you can also ask that same question, Mike, with regards to permitting.
And last, I want to hear from, as we go forward here, I want to hear more about the downtime of either of these projects or with respect to the bridge.
We actually told them, I did, that I have a member who's very concerned about that.
Yeah.
Not just one.
That
all five of you,
didn't
but-
sleep.
You mean how long the actual?
Yeah,
what-
closure would be.
For both.
Well, let's look at East Street, sorry.
You could, that question came up when we last talked with Mass DOT, and
Yeah, so
and it's actually,
what
they
was-
made an interesting reply to that. You can also
See,
bring
how
that
old
up.
am I? Okay.
Yeah, you
So-
can also ask them that question as well.
So it's a big issue.
No doubt.
Yeah.
So it's going to be addressed with
All right.
who, Marco and, okay, great.
Could I just,
Yes,
if you're
please,
done
Alicia.
deliberating, I just
Yep.
want to say one more thing. It is very important to this group of donors and myself to go through this process and that we're very happy it looks like might happen. I think it's twofold. First, this group really wants to save the bridge and hope that it remains wood. The other point of this effort is to assist you so that you have apple-to-apple comparison. And I think that I mentioned this at the last DOT presentation, and it was a question that I had asked Marco. And he said he would get an answer. I don't know how to go about getting that, or if maybe one of you has that already. But it would be very important that we also have the maintenance plan and the costs going forward for what they're offering us, because, this sounds great. It's, free. It's a shiny new object. It sounds great. but it doesn't come without its own set of criteria. It is not going to last 30, 50, 70 years without anyone touching it. What does that look like? What kind of maintenance is going to be required on a structure like that? Sandblasting, painting, asphalting, a myriad of things might need to be done on that when you're marrying up lots of different materials. What are the costs associated with that, long-term, short-term? Is our DPW capable of handling those things? Do we have to bring in outside people? I think that these are questions that the town needs to have while you're evaluating. We're going to do our very best with just a level 1 to get you as much data as we can on that, on what the costs are and what the repairs look like and the maintenance. But I do think it would be only fair to this effort that you have the same data presented by DOT.
Yep.
Okay.
Alicia, can you tell me, how many levels are there, and what
There are
does a
3.
level 1 consist
I
of?
was
There
just
are
going to
3.
ask that. Because we've said level 1 repeatedly. So are we
should have
truly able
clarified
to get what we're looking
it's
for
a
out of level
1
1?
out of level 3. So level 3 would be a very, very detailed, comprehensive investigation on every pier, on every single part of the bridge. If the town were to move forward with that that agenda, if you decided that you wanted to keep it wood and do the repairs, in order for an actual design and all of that other work to be done, we would have to go through a much more intensive level 3 inspection.
And how much does that cost?
That is, I would have to get back to you. I think it's about 200,000, but I need to check. I don't want to speak out of turn.
Okay, so that would be,
That needs to be in whatever report comes back, that those costs need to be in there, right? Because
Yep.
so level 1, right? But to be
Yep.
able to get so there'll be a range of costs, all right?
Sure.
so I have some concerns about that. If you're doing a level 1 inspection, which I understand cost-wise, but there could be a lot of surprises. I mean, if we then make the decision to go forward, then there could be a lot of surprises, things that had not even been looked at, right?
I mean, I think the level 1 is going to give them a pretty good sense of what we have. I think the level 3 is only necessary if you're entering into the design phase.
That'll be a great question for us, for our peer.
There's going to be
consultants
some
to ask.
species identification done on the piers and some other testing just for.
And you'll be able to, when he comes back to and gives us a presentation.
Yeah.
These are going to be good questions based
Right.
on
Okay.
what we find out.
Right.
And ultimately, the key is that whatever is recommended, and this is what we need to double check with our SGH peer review, is that whatever recommendation that comes up from Dr. Tingley WRD, the ultimate test is DOT. DOT decides whether that bridge is safe to be used or not.
That's true.
So with that, that's a big commitment from Dr. Tingley and WRD, is they've got to say, hey, if you guys embark on this restoration of this wooden bridge with this kind of level of cost, you will also get approval from DOT to be able to use that bridge, because if not, then we're wasting our money, right?
But we have to start somewhere.
Yeah, no, I
This
just,
is how
No,
we're
I
gonna
just
again,
do
this
it.
is
Yeah.
complete and open transparency. We've got to make sure we fully understand the
Exactly.
implications of both decisions.
Yeah,
Right, and
absolutely.
ultimately, the decider on who uses that bridge and how we use that bridge is DOT.
Yeah.
right?
Okay,
That's their job.
that's all the questions I have.
Yep.
Any questions from the public? You guys all set?
Oh, dear.
I will take a motion.
Oh, hold on, I don't know where the motion is.
Right here.
Oh, it's right there. I move that the board approve the temporary access license for study and non-destructive testing of the Powder Point Bridge for the purpose of obtaining study information and documentation as specified in the license as presented.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Opposed, abstentions, unanimous.
Okay.
Thank you very much,
Thank you,
Alicia.
Alicia.
Thank you,
No
thank you
problem.
to
And
the
Frank.
group. I know you're
Thank you very
working
much.
hard, and this is a very much appreciated donation that this group is making to provide us with very much needed and desired information. So thank you very much.
You're welcome. Thank you very much.
Okay, next item on the agenda.
Betsy, Betsy.
Betsy.
Forgot your jacket.
Oh. Do you know how many places I love this jacket?
I do the same, all the same, Betsy.
The
Take care,
next-
Betsy.
The next item was a discussion and vote regarding waste disposal contract with Nauset Disposal, but that is going to be continued, or are we doing that tonight?
No, next meeting.
Next week?
Yep.
Okay, so
Okay.
that is going to be continued to
27th.
next week. Or the next meeting, which is the 27th. We have a discussion pertaining to the Plymouth County Municipal Outreach Survey, and that's going to be presented by Brian Glennon.
Very briefly, when Nancy was still here, she forwarded to each of us a copy of what's called a municipal input questionnaire. It's one page, 4 questions. And it's on the agenda tonight, simply for me to remind you that it's out there. I'm looking for input. It came to me originally as chair. I'm happy to continue to own this process.
Please do.
To get the
do.
the response back to the county. I've already received collective input from the school department.
All right.
Okay.
Awaiting input from our department heads through Rainey, and then it would just be the 5 of us.
Okay.
You're not compelled to respond, but if you have any input, and the purpose of this questionnaire is for the county to determine whether there are opportunities for additional regionalization, collaboration,
Ooh.
that sort of thing. So,
Yes, I think I come up with I've got one.
yeah,
I've got
exactly.
a couple, and I mean, I think we can
Yeah.
talk about this,
Yeah.
but I don't want to, I felt like everybody, you probably have been asked or received quite a bit of feedback about I always feel like it would be smart to have a regional planner when it comes to coastal resiliency issues.
Right.
A planner that, multiple coastal towns could utilize.
We already have a Plymouth, Kingston, Duxbury coalition, for the bay. That
Okay,
would be
is-
a reasonable threesome, so to speak, for a municipal planner.
Oh,
I mean, a resiliency.
Climate resiliency planner.
Yeah.
And then the other thought I had was about water. We're going to be spending a ton of money treating PFAS, yet all of our water is coming toward, other towns, it's all coming towards the ocean, and it has to go through us before it gets there.
So tell them to keep
So-
their PFAS in their own towns?
That's exactly
So,
right.
yeah,
Instead of
so
a
We're going to
wall.
be the recipient of other people's,
Yeah,
so those are my thoughts. Any thoughts?
Yep.
okay.
Well, I just generally, maybe once we get some feedback.
Yes.
I know this is kind of an outline to give to the commissioners. I'd love for 1 or 2 of them to come here at a future meeting and discuss these with our professionals about ideas that we have for regionalization or for dividing and conquering costs, but that affect us. Because Brian and I have gone to these meetings, and there's great ideas. Some of them just don't really work for Duxbury.
Okay.
Or marginally do. And I think it would be important for the commissioners to kind of hear our feedback, and really our professionals' feedback about ways that we can regionalize a lot of these costs, because I think that's the direction things are going. Everybody's getting crushed
Yeah.
from the revenue expense side of
Exactly.
things. And, I think that's probably where we're headed with a lot of these things.
Yep, and I think that's the purpose of this questionnaire is for the county to get that input from all the communities. And I think we're doing a pretty good job making sure we cast a wide net within the town itself, so we can go back with basically one set of very detailed comments. And I'm sure that they'll be actionable after that. Once the county has all the communities, I'm sure there'll be meetings. But I'm happy to pass that along.
Yeah.
Since we're on the topic, I really was just a reminder. So if you can get it maybe to Rainey at your earliest convenience, so that he and I can put
Looks like an
together
eye.
something. Yeah, they're looking to get comments back by Thursday, the 30th of April from us. So if I can have like a week to work with it, that would be helpful. So I heard regional planner for coastal resilience, opportunities for regionalization, maybe for work that departments do
Yeah.
from town to town. We already did that with veteran service
Yep.
with
Yeah.
Kingston. There might be other opportunities for that sort of thing. If you have anything now, I'm happy to take it down.
Yeah.
Send you this if you're interested. One of my colleagues, we all talk, the managers and administrators and I, responded with this to all of us. The only area, this was in response to having received that, the only area that we would request support is for the county to take the concerns of all the towns in the region seriously as it relates to our accelerated Plymouth County retirement assessments. We all feel that the county is simply not listening to our concerns about the extremely negative financial impact of your accelerated assessment schedule. We have asked the county to consider extending the schedule to the maximum amount allowed by state law, in addition to providing us with the relevant legal documentation from PARAC as it relates to this issue. Unfortunately, we do not feel that this concern and request has been taken seriously. We would respectfully request that this be given appropriate consideration rather than the dismissive rejection that we've received to date. I can send you that if you
I'll
want.
put that, I think you did. I'll put that under financial and operational challenges.
Yeah, proposes, yeah.
All right, and if anything pops up, please share it.
Thank you.
My thought is to aggregate it all into one response
Yep.
Okay.
and ship it off.
Did it go to police and fire too?
Went to all department heads.
And it went into all department heads, right?
Yeah, I had brought up one during when the police came in the budget season last year, about body cameras and regionalizing, working with the DA's office and things like that.
Centralizing the data
Yeah,
storage. and all
because
that,
data
that's a big-
storage.
Yeah.
Even the cost of some of these things going in on it as a group, these are expensive items.
Right.
And I know Chief Reardon's always looking for ways to seek out grant funding and things like that, but I don't know if there was ways they can work. And I'm sure they all do. I mean, everybody's working together, Metrolec and all. It's just, I'd be interested to hear if the police and fire have any ideas from their point of view.
Thank you for that.
All right, anything else?
That's all I have on this
From the
one.
public, thank you very much. Next item on the agenda is discussion and vote on finding of uniqueness determination regarding Duxbury Beach reservations. It's being
This is
presented by
the
Randy
perennial
Reed.
one, the same
Yep.
one, right, every year?
Yes, sir.
It is.
Thank you, Madam Chair. I can forego the reading
You
of
don't
the
need to
memo
read
and
it.
just tell you.
The five of us have heard it.
Why do the uniqueness of beach property? Because under Chapter 30B, Section 16, if the total rent to be paid under the lease is more than $25,000, then you have to go through a procurement process, or you have to document that this land is unique and that no other parcel will satisfy the town's needs, which is certainly the case here.
Yes.
The town deemed the property unique last year, and I suspect you might do it again tonight.
Well, maybe
You have a motion.
maybe Duxbury Beach Reservation will reduce the lease to $24,000.
That's not
So we
part
won't
of
have
this
to do this
discussion,
every
but
year.
that's-
We can save us some time.
Yeah, $24.99.
What a
Just
good
keep it
idea.
right under there.
Like,
But
good
anyways,
idea.
you have a motion there in front of you. It's in bold. So hopefully that helps.
Oh, this whole thing?
Should have
No,
Mike
no,
make
you
a
don't read
motion.
it.
I think that is the motion. He says it's in bold.
I move that with regard to the proposed lease by the town of Duxbury, of land owned by the Duxbury Beach Reservation, Inc., consisting of approximately 66 acres and including any improvements thereon, and located at and described as all the land and interest in the land in the towns of Duxbury and Plymouth called Duxbury Beach, owned by the reservation south of a line running approximately east to west along the northerly edge of the northerly parking area at the east end of Powder Point Bridge and north of the entrance to Gurnett Sakewish, subject to continuation of the Massachusetts Audubon Society migratory shorebird refuge at High Pines, and excluding the land at High Pines now or formerly leased to Patrick J. Cudmore. I move that advertising concerning this lease will not benefit the town's interest because of the unique qualities or location of the property needed by the town, such land satisfying the town's unique requirements in the following manner. The property is located immediately adjacent to and comprises part of Duxbury Beach and provides access to the beach. Similar access to the beach is not possible from other locations as the result of the local geography and environmental limitations in the area, and the parcel provides much-needed parking for and access to the beach for members of the public.
Second.
Any discussion? All those in favor?
Aye.
Abstentions? No. Okay. Discussion and vote regarding annual Arbor Day proclamation.
Thank you.
There it is.
Take a motion.
Whereas the town of Duxbury has been named a Tree City USA by the National Arbor Day Foundation, a nonprofit education organization dedicated to tree planting and environmental stewardship. And whereas the town of Duxbury has received this national recognition for over 20 years, and whereas the trees can reduce the erosion of our precious topsoil by wind and water, cut heating and cooling costs, moderate the temperature, clean the air, produce oxygen, and provide habitat for wildlife, and are a source of joy and spiritual renewal. Now, therefore, we, the Duxbury Selectboard, by and through its chair and Duxbury Town Manager, do proclaim April 24th, 2026 as Arbor Day in the town of Duxbury, to be observed with ceremonies at the Chandler Elementary School. We urge citizens to support efforts to care for our trees and woodlands and to support the town's community forest program. It's not really
Amen.
a motion.
It's not really a motion, but it is a proclamation.
It is a proclamation.
I think we
Second.
all subscribe to.
Yes.
All those in favor of the proclamation?
Aye.
Okay. Town Manager's report.
Thank you, Madam Chair. Just want to let you all know that last week, the fire department let me know that they received a grant in the amount of $11,000 for FY26 firefighter safety equipment. And as I will read the note from Chief Reardon, Rainey, I am pleased to announce that our department was awarded almost $12,000 in grant money from the Department of Fire Services. This grant will be used to replace aging equipment and will remove the requests from capital requests. The whole process, including needs assessment, quoting of equipment, writing of narratives, and submission were all done by firefighter Kevin Heath. The fire department is working hard to find alternative funding streams for our needs, and Kevin stepping up to do the grants is a benefit to our department and the town. Also, this is not Kevin's first successful grant. He's done others before, so I wanted to thank Kevin and the department as well.
Great job, Kevin.
Thank you.
Great work.
Good job.
This is more of a question. Cindy, I know that at a previous meeting, you had asked to have, as a future agenda item, but I know you will be out of town for a little bit, as a discussion of the various forms of tax relief that are available. And so what I did was I spoke to Scott Timilty, our Director of Assessing, and what he was kind enough to do was put together a package, all of which is available on the town's website. And I was going to provide that information to Susanna just to make sure that it adequately covered it. But you will see there are a whole bunch of real estate tax exemptions for FY26. And you'll also see the link. You'll also see the webpage information listed in there as well. I didn't know if you needed more than that, or?
No, I don't. I think this is great. I just think we also need to be able to,
Sure,
maybe
we-
at a meeting, excuse me, share, verbally at a meeting.
Yep.
And certainly, maybe get one to Susanna, who
Yep.
can
Got one for her. Yep.
provide some information on that.
Okay.
No, that's great.
My understanding is that, and correct me if I'm wrong, did he correct you? I think we participate in pretty much every, wherever there
Yep.
can be
Pretty much.
an exemption or an opportunity for tax relief.
Yep.
And I do, want to make sure that the, community is aware.
Right.
Absolutely.
Yes.
Yep.
At your next meeting, I'm going to have it on the agenda to discuss and vote a set of select board goals.
Yes.
And I would suggest, if you don't mind, one goal per board member, only because right now it's a bit challenging trying to keep up with all of them, and we're going to be in that state for about a year. We've got a posting for the position of my assistant that's active. We had a large number of candidates, and we've started interviews already. But it's going to take at least a year to bring that person up to speed, and then once we get that person, shortly after we get that person in place, it's going to take the other person another year to get that person in place. And that was the case with Nancy, because it took Nancy about a year to get up to speed. But when Nancy was hired, we still had an assistant there who was Anne Murray. So she was
Right.
able to teach, if you will, or whatever.
Mentor.
Thank you, mentor. So I don't have that, so it's a little challenging. And I can certainly provide you with some examples of, I'll let you know the goals that I have, so we're not duplicating efforts. I'm looking at you, because one of them
Yes.
is a carryover, and I'll
Yes.
let you guess what it is. So you don't need to include that, because I've already got it.
Okay, good.
So,
Thank you, Rennie.
You get a freebie.
yeah, so actually, you
You get a freebie. You get a goal because he's already taking
but
one of yours.
I'm not telling you to do just one, but I'm
Yeah.
politely requesting that you consider it at least.
Lucky guy.
So that's that. And then finally, I wanted to let you all know, in case you hadn't heard, our first finance director and former colleague of mine and friend, John Madden, passed away last week.
What?
Yeah, he had worked here from 2006 to 2018. He was the town's first finance director. In the 12 years he worked here, he was a lot of fun. I really enjoyed working with him, and he will sadly be missed.
That's sad.
He was young, that's sad, terribly sad.
So that, I don't mean to leave it on a sad note, but that is the end of my report.
With the goals, even though, he's asking for one, but a lot of times we have the same goals. So I think come with your list of goals
Right,
in
right.
case there's a lot of duplicates.
Yes, and I'll also provide you with an update as to where things stand with the ones that you had from last year.
Good.
And that's at the next meeting.
Yes, ma'am, the
And that's on
27th.
the 27th. Yep,
Yes.
Mike.
Go right ahead.
Oh, Mike.
Just, Rainey, did you want to acknowledge our helpers here that are sticking us out for the 9 o'clock hour?
Andy.
Um,
They're
yes.
awesome. I wanted to thank you both, Ange and Lauren, for helping us out. It means a lot having you here. I didn't know you were going to come down, too.
I just thought I'd be assistant.
Look at you.
Ooh,
Assistant
nice.
to the
This is
assistant. Thank you very
is
much.
really appreciative.
Thank you.
Thank you.
Enjoy yourself.
Yeah.
Very informative. I learned a lot. I didn't know.
I know, I keep telling people to come to our meetings, and
They are
nobody,
fun.
nobody takes me up on it.
I don't know why, Mike.
I got Suzanne to come.
Rennie, we've lost Sheila, but normally in the new year, right, at the transfer station, we should have the new stickers. People should have paid for the new stickers.
Yeah, there's a sign out front.
Yeah.
Well, I know there's a sign, but in previous years, we've had, I think, what's that not work release, but something from the Council on Aging? That's the same thing.
I don't know if they're the same.
People who do it for tax relief.
Tax relief, not work, yes, that's what I meant to say. Sorry.
I feel like work.
The tax relief, they actually stand there outside and make sure, because I do see people being turned around, right?
Yep.
Because they haven't paid, so.
Yep, I'll talk to
I
Sheila
haven't
about that.
seen that this year.
They
haven't
usually
either.
give people a little bit of a
Well,
breather.
I haven't seen people get bounced yet, is what I'm saying.
I haven't seen somebody standing there that does,
Yeah,
That-
I'll ask Sheila.
as Sheila. That's what I've seen the previous years, somebody standing there physically
Yep.
checking people.
I was checked out on the beach. We're
Good.
checking me out there.
Isn't there an electronic way? They have a little sticker on there.
Used to be. It didn't work.
It didn't work?
They tried it, yeah, about 5
I
years ago.
thought you could get
It
down to
failed.
the beach until
Shows
Memorial
how
Day.
often I go.
It failed miserably.
I'm glad they're checking, because they're expensive stickers, and
Yes.
I pulled onto the back road, and he said, "You got an old sticker?" And I
On the
said,
back road, but can you get to the parking lot before
I mean, he's sitting right there, so I wouldn't test the waters.
You need to buy the parking lot.
You need to
ticket.
buy a sticker.
I thought
Okay.
you had free pass until
No.
Memorial Day.
No.
I don't know.
We
No,
have
look, see, I had to buy mine, March 31st, they expire, right?
Oh, I
1st of
know.
April.
Yep.
anything else under the town
And
manager's report?
I got my sticker.
Okay, and we have some minutes.
Minutes, the minutes are of, our,
Friday,
short
April
meeting
3rd.
on Friday, April 3rd. And, does any
Just a motion, I think we're,
motion
we
we're
all
good to
read
go?
them.
All right, I move the select board approve the April 3rd, 2026 open session minutes of the select board as presented.
Thank you, sir. Second.
Any discussion? All those in favor?
Aye.
Opposed, abstentions?
Aye.
That's good to note that obviously with the use of AI and Claude to summarize the meetings, Brian hasn't corrected a single minutes since that moment, I seem to remember.
Well, that's-
You were all over those
there's only been
minutes
a
in the
couple.
past.
I usually handle them ahead of the meeting.
Oh,
And he uses his own AI software to
Talk
check the
about
other,
it.
right? Yeah.
oh, right.
So-
Are those okay as presented?
All right, so, okay.
Yes, as
By the time you
Nice.
see them, they're already correct.
They're already corrected, okay. Thank you.
I thought I found an announcement somewhere, but now I don't see them.
Do we have any announcements tonight, Rainey?
No.
No, we have no announcements.
Oh.
So our next meeting is April 27th. There is a meeting, what was coming up this week? It was,
It's Route 3 Mass DOT meeting. It's virtual only. It was originally scheduled, I believe, for April 1st. It was moved to the 15th. Anybody who has not had an opportunity to sign up yet, if you simply Google Route 3 Bridge DOT or something along those lines, it'll be the first thing that pops up, and there's a link to put in your contact info, and you'll get a link to log in to Zoom when the meeting comes up on the 15th.
okay, did we not get an email about another meeting that is happening?
Friday.
I don't,
Morning about the beach, that one?
I thought there was something else that came, but, okay. All right, be done. Okay.
Can I have-
I'll have
can
a
I
motion
sign?
to adjourn.
yeah.
Second.
I
Oh.
can't make the motion. Can I
I
get a
move to
motion
adjourn.
Second. Any
Second.
discussion? All those in favor?
Aye. Nice work.
Nice job.